Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with a joint faculty appointment at Ross University School of Medicine. And in this video, I'll be talking some about ethical considerations, but specifically in the context of psychiatric research. Now, unlike some of the other protected individuals, psychiatric research is more difficult to discern because of the sensitivity of the population. So in other words, you can't have a clinical trial where the individual is deprived of all medication as being a control. So in psychiatric research, that needs to be under consideration. But some of the interesting parts of this was it's published in the Indian Journal of Psychological Medicine, and some of these interesting concepts are visited in this paper. So it starts off by ethics, which comes from the word ethos, understanding right and wrong. So the World Health Organization thinks that, or has given a number of 10% of the world's population suffering from some psychiatric illness, and a fourth of a person experienced some psychiatric illness during their lifetime. So maybe that some individuals may experience some of the components of a personality disorder, or even some of the components of the depression scale. And for instance, maybe they can constitute lack of sleep and lack of appetite, but the rest are normal. So you have to make consideration based on what has been given. So considering various issues involved in psychiatric disorders and research, ethic plays a role. Now, I wanted to go back here, and the researchers bring up psychiatric disorders itself carry significant stigma. So causation of psychiatric disorders has varied beliefs as described by cultural psychiatrists. So considering various issues involved in psychiatric disorders, ethics plays a role. Historically, ethical abuses in human research has been quite prominent by Nazi doctors on convicts, following which the first international standard for ethical consideration actually was framed. So the Nuremberg Code in 1947 was the purpose of this. You might have heard of the Nuremberg Code. It was based on 10 principles focusing on voluntary consent, right to withdraw from the study, and prohibited studies causing harm to patients. The World Medical Association, they adopted the principles from the Declaration of Helsinki, consisting of 32 principles, which focused on informed consent, confidentiality, vulnerable populations, and requirement of a research protocol stating scientific rationale of the study, which need to be reviewed by the ethics committee. So the infamous syphilis study at Tuskegee, the National Commission, following in 1972, the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research, became known in 1974. This was further drafted in the Belmont Report, Ethical Principles and Guidelines for the Protection of Human Subject of Research. So in India, how has it been mental health research? Well, there's ethical committee, there's ethical guidelines for biomedical research. Now, when we think about some of the developments that took place in the 1970s, after the TED Declaration, I said 1970, the American Psychiatric Association appointed committee to develop a code of ethics. So 1977, the World Psychiatric Association, which I actually attended a lecture, presented some original findings in the conference. They developed a code of ethics for clinical practice known as the Declaration of Hawaii. This was later adopted by a committee in 1989 at annual National Conference of Indian Psychiatric Society at Orissa, India. So translating some of these practices into different countries is quite challenging. And of course, the principles are also different according to the time. So at this during this time, responsibility, competence, benevolence, moral standard, patient welfare, and confidentiality are all respected. No guidelines in context of psychiatric research. This was in general research, but if you specifically need to be thinking about psychiatric research, there's other features that need to be properly evaluated. So further, India, which is the second largest populated country in the world, houses 1/7 of the world's total population. So, second largest population and 1/7 of the world's total population. Pretty significant amount, if you ask me. So, is rapidly becoming a research hub for human research. So, all of the different ethical approaches need to be visited and considered in the context of the various disciplines that are being covered. So following globalization and industrialization, multinationals have an emerging interest for research in this area because if they're trying to implement whether it's a educational center or if they're trying to implement some sort of intervention program from public health, initially there's a lot of pushback from individuals that are entrenched in some of the natural remedies versus understanding some of the not only remedies but the ethical regulation of these remedies, which are not necessarily approved by the India. So there's some retracted or there's some retracted rates of journals and where journal articles were retracted and goes into some details there. But I think the major, and you can read this over. I think the main, another part that I want to read over is with advent of research in psychiatry, the number of diagnoses is on the rise in neuroclassificatory systems. Example, 106 in Diagnostic and Statistical Manual of Mental Disorders, DSM. First edition was DSM-1, 1952. So just seeing the rise in disorders. So the second edition, 182. So we go from 106 to 182 in DSM-2. Rose to 265 in DSM-3. And then 297 in DSM-4 in 1994. Approximately 340 it rose to in DSM-5 2013. So for instance, DSM-5 has OCD, obsessive compulsive disorder, disruptive mood dysregulation disorder, somatic symptom disorder, illness, anxiety disorder, hoarding disorder, excoriation, disinhibited social engagement disorder, avoidant restrictive food intake disorder, social pragmatic communication disorder, restless leg syndrome, binge eating syndrome. Anyway, so these examples are important to note. Some of the specifics, for instance, caffeine withdrawal, cannabis withdrawal, factitious disorder by proxy, rapid eye movement, sleep behavior disorder, and they go into a lot more details than the original 106. So we went from 106 to all the way to 340. And I believe DSM-6 is on its way. So we'll see how many diagnoses that has. So recommendations, diagnosing a person with mental illness while recruitment and research, one must keep in mind about various psychological and social consequences of diagnoses of that in diagnosis. So how do you typify and classify and keep cultural considerations in mind to provide not only research but also understanding for the sake of science and intervention, where the ethical considerations are most important. So, in involuntary treatment, mental illness often compromises person's decision-making capacity. Insight related to need for treatment. So the treatment aims at modifying behavior perceived as an implied threat because the psychiatric treatment occasionally may be utilized for controlling behavior for certain vested interests. So physicians, psychiatrists to execute principles of beneficence and non-maleficence to treat patients, making balance with autonomy of patients. So typically beneficence and non-maleficence, which is more controlled under the doctors, is weighed versus autonomy, the ability of individuals to make conclusions based on this. So then they go into ECT, electroconvulsive therapy, that I'm not really, I don't know how often they use it, but let's take a quick look. Informed consent needs to be taken from legal guardian, keeping into best interest of rights and patient. So even ECT research, this should never be performed assuming that no person with full decision-making capacity would ever consent for any painful procedure without anesthesia. So this goes into understanding ECT and being able to how to do research effectively, and taking a look at the dichotomy of research. So recommendations go into a lot of, and then understanding how placebo is viewed. So I hope this has provided you with some initial understanding of diagnostic and statistical manual DSM criteria, where we are at 5, how many diseases this covers, and also finally electroconvulsive therapy and some of the more controversial treatments, and also understanding how psychiatric treatment is usually paired with some of the natural therapies in a natural context, sort of like classic context and understanding. So that's about all. Thanks for listening.